In this video, I'm going to be talking about how we navigate around the human body, the terms we use that describe where things are happening, where structures can be found. So first of all, anatomy and physiology, let's break down those two words. Anatomy is referring to specifically the structures in the body. And anatomy can be thought of as having two parts. The big structures are gross anatomy. Those are the things that we can see without a microscope. But then there's also microscopic anatomy, the cells that are making up the tissues that are making up the organs. We can see the organs, the cells, we need to use a microscope. And then physiology is the study of the systems and how they contribute to life. So we go beyond the structures, but talking about how everything works together. In physiology, you can focus on particular systems such as cardiac physiology, which of course would talk about the heart, or digestive physiology involving the digestive system. Over and over again, you're going to hear me say that form follows function. So the way a structure is put together is going to determine how it behaves, how it functions, how it contributes to the sustaining of life. And whenever there's a change in form, often because of disease, then you can have a loss in function. So first of all, to navigate the human body, we need sort of a standard starting point, and that's known as the anatomical position. And that is a upright standing position with the legs slightly apart, and the thumbs are pointing out. So you can see the hands are turned, so the thumbs are out, and the palms are supinated towards the front. In this position, when we talk about right and left, we're talking about where they fall on the body. So the right side will be on our left side as the observer, but it is the body's right side and left side. Then we have directions for comparing one part to another. I've already talked about right and left, but above is superior and below is inferior. So your nose is superior to your chin because the nose is above the chin. There also is an imaginary line down the middle of a body, the midline, and something that is near the midline is medial, where something that's moving away from the midline is lateral. The words distal and proximal have to do with a joint. So is something close to a joint or far away from a joint? If the knee joint is what's in question, then the ankle joint down here is distal to that joint. The front and the back of the body actually has two names that you have to become familiar with. Both anterior and ventral means the front or towards the front, whereas posterior or dorsal means towards the back. This is usually pretty easy to remember if you think about dorsal fins on a shark or a dolphin. Those are found on the back of the animal, and so the dorsal part of the human body is also to the back. Then we also slice the body in various ways. This is especially important when you're looking at images that are generated by CAT scans or X-rays. And so going straight through a cross-section through the body is a transverse plane. You see that trans, across prefix there in the word. Then if you divide the body so that there is a front and a back, so it would be kind of slicing down through the side. That's this plane here is trying to show if we slice somebody, that's going to kind of go right down through the middle of the body. So it would have a front side and a back side. That's the frontal plane. So that again is easy to remember because frontal has front, starts with front. And then the last one is if you're going to divide the body into right and left sides, and so that can be called a median plane or a sagittal plane, or if it's exactly in the middle, a mid-sagittal plane. That one there's not an easy way to remember, but anything with sagittal or middle is going to be right and left sides. And then we have the cavities inside the body. So body cavities refer to open spaces within the structure of your skeletal system and the muscles surrounding that. And in these cavities, we have various organs. Starting at the top of the torso, we have the cranial cavity, which of course contains your brain, and that merges right into the spinal cavity containing the spinal cord, because of course your spinal cord comes right out of the bottom of the brain. In the torso area directly, you start at the top with the thoracic cavity that's going to hold your heart and lungs. That is bordered on the bottom by the diaphragm. And then below that, we have one big area, the abdominopelvic cavity, which is divided arbitrarily into two sections, the abdominal cavity and the pelvic cavity. The abdominal cavity, this upper part, is going to contain most of your digestive system, where the pelvic cavity, which is kind of nestled between the bones of the pelvis, or the hip bones, will contain the very end of the digestive system, the reproductive organs, and the bladder. And then you have general regions on the body. For example, you may have heard of someone having carpal tunnel syndrome, and carpal is going to mean wrist. So carpal is a word designating a particular region of the body. It's the wrist region. Or we've already mentioned the pelvic area, that is the region that's surrounded by the hip bones, the pelvic girdle here. Inside the pelvic region, kind of that crease that's over by where the thigh connects to the hips, is the inguinal region, or also sometimes called the groin. On the back of the body, you've got your buttocks, the gluteal region. You may know of the gluteus maximus, that large muscle that's so important in movement. Then on the foot, we have the tarsal region, which refers to the ankle. And sometimes it gets broken down to other smaller, like the metatarsals. We're going to hear that when we hear the bones. You may know somebody who has plantar fasciitis, which is inflammation of the connective tissue on the bottom of the foot. So plantar is the sole of the foot. This person's not in an anatomical position here because they have them on their toes so that you can see the sole of the foot. The foot itself is the pedal region. Then moving up, your thoracic cavity we've already talked about, but you also have the thoracic region. In the middle of that is your sternum, this bone down the middle, which refers to your sternal region. You have the axillary region under the armpits, and of course mammary, referring to the mammary glands, more significant in women being involved in breastfeeding. The neck is known as the cervical region. You may have known someone who had a whiplash from a car accident, had to wear a cervical support, a kind of foam padded collar around their neck as that part of their body was healing. The head can be called cranial or cephalic. Usually when we're talking about regions, it's cephalic region. And then on the face, there's a number of other regions that you probably already can imagine what the nasal region would be, or the oral region. The eyes are known as the orbital region. When it comes to the abdomen, along with the general abdominal area, the specific area around the umbilical cord has its specific name, is the umbilical region. The hand, we have the carpal for wrist, and then some of the fingers, those also are the bones of the hand, are known as the metacarpal region, and the metacarpal bones, they're the long bones that make up your hand structure. The fingers are digits, and the palm, very easy to remember because it's palmar, so you see the word palm in it. Brachial refers to the arm, and then there are more specific areas within the arm that I'm not going to ask you to remember. Along with just the general vertebral area down your spinal column, all those bones. On the back, you have the scapular region around the shoulder blades, or the scapula bones. The lumbar region here in the lower back, where a lot of people experience pain. And the sacral region around the tailbone, the very, very bottom of the spinal column. So those are just some of the regional areas. I just wanted to point out, you'll be responsible for knowing some of these, but not every single one that's on this list. So refer to your vocabulary flashcards for the exact ones you have to know. So now take a few moments and check your understanding for these terms to navigate the human body. Can you use the directional terms correctly? Do you know which way is lateral, where medial would be found, proximal, distal, inferior, superior? Make sure you know those terms and can use them in describing places on the body. Can you divide the human body into the different planes, whether it be sagittal, frontal, or transverse? Can you match body organs to the correct body cavity? Which cavity is the heart found in? The brain, the bladder? And can you locate individual body regions by the correct medical term? If your notes are lacking in any of these areas, go back and review those parts of the video because you will need to know this for the quiz.